Borla. I think it's true to say that successive governments have undervalued and very much under-recognised care, and unfortunately I think not a whole lot has changed during the last 3.5 to 4 years of this government. It seems that care is increasingly being viewed now as a commodity, with private providers operating almost 80% of nursing homes, while only 39% of home care hours are provided directly by the state. However, this rampant outsourcing is a more recent phenomenon, particularly in the home care sector. We know that in 2006, funding to private home care providers stood at just €3 million, but by 2019 it had risen to €176 million. It's very welcome that additional funding is going into this sector, but why is it all going into the private sector? Because we know the impact of that. When more money goes into privatising services, outsourcing services, then what we see is the monetising of those services and actually wealth extraction from them. That's not in the country's interest, nor is it in the interest of those in receipt of care. It's an abdication of responsibility, really, on behalf of the state. This dramatic shift happened with very little coordination or consideration by the state, leaving in its wake a largely unregulated sector with poor pay and conditions. This damaging legacy could be addressed in part through full implementation of the Strategic Workforce Advisory Group's recommendations and the introduction of a long-promised statutory home care scheme. We're still waiting, Minister. In 2018, a statutory right to home care was first promised, with a 2021 target for delivery. But here we are in almost 2024, and still no scheme. This government needs to accept that a fundamental reconfiguration of elder care is required. The state's over-reliance on nursing homes, which are overwhelmingly private, cannot continue. We also need to start a serious conversation about the deprivatisation of care and begin investing heavily in our public care infrastructure, as recommended by the Human Rights and Equality Commission in July. During the early days of the pandemic, the Taoiseach and indeed the then Minister for Health both recognised that the current model was no longer fit for purpose. But that seems to have been forgotten. They said very clearly in response to me here in this chamber that the model of care for older people was no longer fit for purpose. It was in the middle of COVID, and essentially we've seen no improvement on that situation. Could I have some water, please? The arguments for increased reliance on private providers and agencies to achieve cost efficiencies simply don't hold water. We must accept that these efficiencies do in fact have costs which are borne by service users and workers. Any attempt to define care as a product is the very antithesis of person-centred care, a stated ambition of the HSE. Another area which is undervalued by this government and absent from this motion is safeguarding. There have been long-standing calls for safeguarding legislation, and yet successive governments have dragged their heels, even against the backdrop of a number of abuse scandals that we have seen. I appreciate that the government is awaiting the Law Reform Commission's report, which is expected early next year, now we're being told. But there appears to be very little political will to get this legislation over the line, at least this side of an election. So, how long now have we been waiting on the Law Reform Commission? And when their report does finally come, how long is it going to take to give effect to that in legislation? While the HSE does have its own safeguarding policy, a 2022 Safeguarding Ireland paper found that HSE safeguarding and protection teams are operating in what they call a legal vacuum. Of most concern is that private nursing homes are not within the remit of that HSE policy. This means that their social workers do not have the right to enter private nursing homes. It's a shocking situation, a terrible state of affairs. So 80% of our nursing homes are privately owned, following a particular policy by this government, and indeed the last. But the safeguarding aspect of ensuring that older people are protected from abuse cannot be implemented within those private nursing homes, and our HSE social workers can't gain access for that purpose. I mean, it's a shocking state of affairs, Minister. We know from the Irish Association of Social Workers that social workers have even received letters from nursing homes informing them that they will be prosecuted if they try to enter the premises. I mean, how is it that nothing has been done about that, Minister? This unacceptable lack of oversight also means that safeguarding complaints in relation to private nursing homes are not even collected. So we have no idea about the extent of complaints relating to safeguarding in private nursing homes. And this means we do not have robust data on abuse of older and disabled people. So what isn't measured doesn't get any attention, and that needs to be dealt with. While I accept that HICWA can investigate private nursing homes, their inspections mostly focus on facilities and not individual cases. This absence of investigative powers in cases of abuse and neglect simply cannot be tolerated any longer, Minister. A country with such a long and dark history of institutionalisation and abuse should know far better than that. This government also needs to be reminded that the option to live independently in the community is a human right, and more needs to be done to guarantee that right. In 2011, Time to Move On, a strategy for community inclusion, was published. This 2011 document proposed a 7-year timeframe for moving all residents of congregated settings into the community. 12 years on, and there are still 2,300 disabled people living in congregated settings, and 1,300 people under the age of 65 living in nursing homes. How can someone with a disability have autonomy if their routine is dictated by a nursing home? It's very difficult to have independence when you have a set bedtime and set meal times. This was highlighted by the Ombudsman 2 years ago in his report, Wasted Lives. He found that there was a bias towards institutionalisation, along with a lack of funding to support individuals and their rights. Instead of addressing these pressing issues, our government is spending €1.5 million on advertising campaigns about disability rights, all the while continuing to deny those very rights. Under this government, the experience of people with disabilities continues to be one of social exclusion. They have amongst the highest poverty rates of any group in Ireland, 3 times that of the general population. And more than 2 in 5 people with disabilities are experiencing deprivation at any one time. That is the reality for so many people, Minister. Threadbare services and unmet needs. The very least this government could do is ratify the UN CRPD optional protocol. For children with disabilities, the situation is just as bleak. More than 16,500 children are currently waiting for their first appointment with a Children's Disability Network team. Of these, around 10,000 children with disabilities have been waiting for over a year with no intervention or therapy. I have no idea how you as a government can defend that situation. 10,000 children with a disability have been waiting over a year with no intervention whatsoever. Rather than enjoy basic rights, these children are being actively harmed due to the persistent neglect by the state. Until we start addressing these systemic failures in our social care services, rights-based care will remain purely notional, far removed from the experience of those receiving care. I just want to add that today we heard the testimony of 3 family carers at the event organised by Family Carers Ireland, and they would bring tears to your eyes. They also bring shame to the state, Minister. The idea that we deny our citizens with disabilities the most basic fundamental human rights. This government needs to take action urgently.